Welcome to the Community Health and Safety Council Committee meeting for May 7th, 2025. I'm Councilmember Toohey, and with us this afternoon, we have Councilmember Bader and Fossey. Today, we have two things on the agenda, and the first one is the opioid response and spending plan briefing from staff. And so I'd like to turn it over to staff member Julie Willie.
Oh, sorry. Again, haven't been here for a while. Lots of changes. It's usually a red light. So my apologies. I'm Julie Willie. I'm the Community Development Director. And I have Chelsea Monroe here with us today. She is our opioid program manager. And we want to obviously come periodically and kind of give you an update on what we're doing regarding our opioid response, as well as just kind of keep you updated as to what we know about the spending and the income and the availability and such. So Chelsea's going to start with giving an overview of kind of some of the response that we've been doing. And then you have a couple handouts with you. One of them is the opioid response. The other one's the opioid spending plan. So we're going to start with the one that says opioid response.
Thank you, Julie, and good evening. Nice to see you all. It's been a few months since we were here briefing you on the mayor's task force and the recommendations and report. So I'm glad to be back. During that time, we had shared that one of our next steps and goals was for me, Julie and team to work on what our spending and response plan was. So I'm excited that we're here to talk about that tonight. The document in which I'm referencing is the one titled Opioid Response Plan, which is the blue colored one. And so I am really proud of the work that we've been able to accomplish. I know at the last meeting we talked about, and I think we'll continue to mention, this epidemic didn't happen overnight. And while we've had a lot of progress, it is one that's going to continue to take time and collaboration and partnership, and little wins are going to go a long ways. So I'm excited to share some of those with you tonight. But the opioid response plan is really was developed to ground us in the work that we're going to be doing moving forward. And so how we created this was we took the 4 buckets of work that were identified and created in the mayor's drug crisis task force, which were education and prevention, crisis response, treatment, recovery and services, and then advocacy and policy. And so you'll see those are the 4 main response categories there. But we also recognize that part of the obligation that we have as a city with receiving opioid settlement funds is to make sure that we're aligned with the opioid settlement fund management practices and policies. And so really felt like that was a core focus of making sure we're compliant and following those guidelines. So we added that as a 5th. And then recognizing the ongoing need for partnerships and collaborations, that is going to remain front and center because, again, we can't do this work alone. And so that's kind of rounding out that 6th bucket of work there. And so we feel really strongly that these 6 buckets will ensure that we're implementing the strategies that were both identified through the task force that the community and staff wanted, but also fulfilling the other requirements, as I mentioned, and keeping us grounded in the work that's happening with the community. So there's a lot that's listed here, and our thought is that this will be the document that we work to update and present to you to keep you informed of the work that's happening. There's a lot on here, but a few that I just wanted to highlight. When we were here last August, we had just launched the Emote Street Medicine team. June 30th will be 1 year into that project, and they have worked with over 600 folks. We just submitted our quarterly report to the Healthcare Authority. Really proud of the work that they've done and continue to do. The CARE team, the alternative response team, has officially kicked off, and they have done a phenomenal job in kind of pivoting their work and, again, remaining nimble and responsive to what the community needs are. So we're engaging with task force members. I know that's something that I have found both a lot of fulfillment in, because it's easy to say, hey, we're going to do a task force and then check a box and file it away, but really looking at what folks' individual interests are and staying engaged and staying connected to the work because they are allies and champions for us in the community. And then we're also working with our partners to have more presence on social media, both through education and awareness. Working with Snohomish County has invested some great resources through different marketing campaigns and leveraging some of that work that they're doing, but then then sharing it on the city socials. And so making sure that we're working with communications to consistently get that information out. And I think it's been really well received. Folks have asked questions. It's sparking interest. And so that's been really well, or really good to see. And then myself, I know I've been able to formalize joining some groups like the Multi-Agency Coordination, the MAC group, recently joined Snohomish County's Overdose Fatality Review Committee, which has been really helpful in looking at things through that systems lens, understanding what work is happening in the community and where the city can step in and lead, but where there's already strong partners doing that work. And so excited to continue that. But I won't bore you with reading all the details, but just wanted to highlight a few things before I turn it over to Julie, who will talk more about the spending plan.
Are there any questions so far on this part? I think Councilmember Bader.
Thanks. Yeah, Chair Tui. So a lot of good stuff going on. Looks like we're hooking a lot of people up. They're connecting with services, et cetera. And I know it's a difficult population to serve. Any sense of how many were able to get into a treatment plan or program that puts them on a trajectory to be not addicted or whatever? I apologize, I'm using broad terms, but you know better than I do.
Yeah, that's all right. I think the last time we had done a Facebook post to share some of that, it was about 30% of the folks. I think we were more at like 300 to 400 people served at that time. And I know that it's sometimes easy to think like, oh, they should be choosing that. That should be the option that everybody's choosing. But one of the beautiful things about the street medicine team is they meet people where they're at. And sometimes when you're in vulnerable places, it's not as easy to just receive the help the first time. And so what they're doing is they're showing up time and time again to quite literally meet folks where they're at. And so maybe on that 5th or 6th time, they're ready to access services. The other thing that I want to highlight in that number is that not everybody at least through the street medicine team that they meet needs detox or treatment. Sometimes it's just that peer support and that community connection to continue in their recovery journey. And that looks different for everybody. And so our goal, I don't think is 100% is going to detox, because that's not going to be the goal for everybody. So hopefully that answered the question.
I mean, I think our image or the popular image is people who need this are all living on the streets, but are you dealing with people who aren't necessarily homeless or living on the streets?
Yeah, I think, do you want to go?
No, go ahead, because you have some, I mean, and again, this is just about one program. And so I'll want to talk about broader strategies that are also going on in the community.
Perfect. So yeah, to Julie's point, I think, yes, there is more than just those that are on the streets, and an image that you might have when you think of those that are struggling. Through the EMOTE program, though, this really launched to meet the hardest to serve and hardest to gauge folks. So the way they define it is rough sleeping, which means they don't even have a tent. They are quite literally the folks that you see on the sidewalks with no access to anything over their head, is the majority of the folks that they're working with. They can certainly meet with folks, and, as they navigate through the system, if they get connected into housing, can follow up and do some touch points when appropriate. But the EMOTE team is really focused on the hardest to serve and might have the highest distrust of systems. And again, that peer model allows them to build that relationship so that they can navigate a system in a way that helps them be more successful than maybe some more traditional routes we think of.
So I'll just piggyback briefly on that. The other kind of amazing part of this partnership is the medical model that walks alongside of it, and behavioral health model. So we have new programs and services and organizations in our community that are addressing the concerns of opioid disorder, not only with our unhoused population, but with our youth and with our seniors, and also in the space where those that are using and need harm reduction and need access to medical care are getting the medical care and are having opportunities to immediately get medication to help them so then they choose not to go back to taking opioids. So those are other programs that we are getting to partner with doing this work. And certainly our crisis intervention, our crisis response team is also working alongside of that. But we couldn't certainly do it without our police and fire partners. And, you know, fire, like Dave's going to come up in a few minutes and hopefully he'll share a little bit about the buprenorphine pilot that our fire department has been leaders in trying to ensure that people have access to immediate resources if they're viable and ready to take that on. So it's like, sometimes I know we're not supposed to be positive, like, but it really is a positive thing for a very vulnerable population that we haven't had a lot of resources for in the past.
So Julie, are those countywide programs?
So
Partners?
our emote is Everett.
Right.
But there are countywide efforts doing similar projects. We don't have a real coordinated effort yet, but that's part of our future work.
Okay, so the behavioral folks and the medical folk, they're local, they're Everett.
Yeah, yeah, and they do county, they Conquer is the organization that also does additional behavioral health and connections to people in the field. And so maybe we'll get you another opportunity to meet them and understand the network. I mean, the state is also super supportive of this concept, and that will lead us into the spending plan. Last year, you allocated opioid spending dollars to go to our street medicine program, but the legislature allocated money. So we were able to use a grant through the healthcare authority to pay for a moat. So thank you, state, for providing that. And it's our understanding that when the budget is signed on May 15th or something, that there will be an additional allocation for the 5 street medicine programs that were established in last year's budget. And so that will also allow us to continue a moat to potentially expand it or to, you know, ensure that it's going to be able to see some fidelity and some, you know, long-term success. And so again, we won't have to utilize our opioid spending dollars yet. We'll be able to save that or use it for something else. So again, excellent. Thank you, state, for helping recognize that we have a population on our streets that benefit from a peer model and access to medication and healthcare. So then that will lead us to the other document that has the green shaded boxes on it. And that is our opioid spending plan. The top part just kind of reminds us of why we have a spending plan. It is a requirement of the settlement funds and our agreement to accept those funds. And there's kind of that overarching reality of what we have to spend it on. And the big buckets are treatment, prevention, and then strategies related to helping our first responders. And so that continues to be what we want to make sure that we do because of the challenges of the opioid epidemic. And we know the challenges of a lot of other parts of our community and related to violence, gun violence, drug trafficking, those types of things. I feel like we can lead a lot of things back to the opioid epidemic, right? We know we have a fentanyl crisis and we have for many, many years, and or opioid crisis. And so that gives also gives us a lot of kind of flexibility and freedom for these funds to really make a difference in our community and in our own departments here at the City of Everett. So we are being selective. We are being slow and methodical in trying to make plans to spend the funds. And obviously, you will be involved in contract awards or agreement to spending money on certain things. So this is not a one and done by any means. The conversations will continue. But just to give you a quick reminder, between like 2022 and 2038, the city anticipates getting about $8.7 million in settlement funds. On the backside, or the second sheet kind of shows you projected opioid settlement revenue by year. You'll see that 2024 was a large input year because one of the organizations, one of the settlements decided to pay their funds up front. And so we got a big chunk of money. That's not necessarily the case every year, but we also don't know. That it's a moving target that we have no control over. So we have these projections and we're trying to base kind of our future on what we know, not what we don't know. So With that, to date, like I said, we came here and asked for a contract for the EMOTE program about a year ago. And we only used about 60,000 of the 309,000 that you allocated. So like I said, the rest of that money will go back into the opioid settlement funds to be redistributed how we all see fit. Hiring of our program coordinator, program manager, is imperative. This is a big body of work. And to Chelsea's point of all of the different things that we have going on and really wanting to make the most of this opportunity, we couldn't do it without the dedicated staff. Part of the opioid settlement, part of the EMOTE program also pays a portion of Chelsea's salary. So, you know, anytime we can use grant money, we're going to try and use grant money absolutely, to ensure, you know, sustainability as long as we possibly can. Under the education and prevention, we continue to try and work in the community to try and address what new ways to educate our youth and our people of color, or people that speak different languages about the fears and concerns of opioids. One of the things we're going to do is this next Monday, we're hosting a screening of a play called No Place to Grow Old. We have little flyers. You can sign up. We're taking reservations just because we're almost at capacity. We have over 150 people coming, and this is a story of 3 different individuals who are aging and who have had an intersection of a lot of challenges throughout their lives that have led them to have some housing insecurity. It's based in Portland, but it's produced by our very own Michael Larson, who was an Everett High graduate about 10 or so years ago, and who's doing really great things in the greater Pacific Northwest. So it's kind of a good feel-good story for celebrating one of our own Everett High graduates. That's amazing, as well as educating our community on how all of the things kind of fit together. So we hope you all can come, and the community is also invited to attend. And then the next thing that we are proposing and recommending and adding to our opioid spending plan, we're going to invite Chief DeMarco to come up and talk about his need for fleet expansion for our EMS. Certainly the impacts of opioids have been highly affect our police and fire have been highly affected by the number of calls and the wear and tear on equipment and so forth. So without further
I
ado.
asked just one
Oh, sure.
before we move on.
Of course,
to-
I'm sorry.
For you, Julie, about the education and prevention. In the future, do we have anything planned for the schools?
Youth was definitely a priority. So that is a partnership that we will have to develop and create. We're also working alongside the MAC group, the Snohomish County MAC group, that they have like staff allocated to do kind of education work. So we don't want to duplicate. We want to make sure we're doing it in partnership. But that,
So that would fall
Yeah.
into that category with the
absolutely.
dollars.
Yeah, and if I can just add, I think one of the things that the task force identified was that the state actually has a mandate for schools and rolling out in some education and awareness to students, and they have until later this year, I believe, to do that. And so part of our goal is to connect with the schools and learn and walk alongside them with that. Again, we're trying not to duplicate efforts, and if they're already investing, I know they have the curriculum identified that I believe all schools will be using, but we'll certainly use our task force members who are school representatives to partner with them and figure out what that looks like, and then where we can step in and amplify voices as needed as well.
Okay, all right. Yeah, go ahead. Okay, Councilmember Fosse.
Thank you. I believe that was like passage, not this last session, but the previous session with the education. Did you say a particular date with the local Everett?
I'm sorry. The No Place to Grow Old.
Yeah.
Monday, May 12th. Doors open at 5:30. Screening begins at 6. It is at the train station in the Weyerhaeuser room.
Thank you.
Yeah, absolutely.
Postcards are coming your way.
Oh, thank you. Okay.
Okay, good evening, council. David DeMarco, Fire Department. A couple of things. One, I owe these 2 ladies an apology because I missed the meeting where we coordinated what we were going to say tonight. So I was double booked and they haven't seen this, but in short, as they contemplate spending plans for the opioid settlement dollars. And they talk across the city about the impacts to the various operations of the city. Obviously, the EMS providers and systems of the city are impacted by the crisis as well. In front of you is or two handouts. One is City of Everett specific incidents managed by the fire department where Narcan has been administered. And then the other is a Washington State Department of Health printout of opioid incidents managed by EMS across the state. Both intended just to illustrate that EMS is clearly impacted. Fund 153 is an enterprise fund inside the city designated for the operation of emergency medical services. When contemplating the impact to the fund specifically, obviously the first thought that comes to mind are the providers that have to come and respond to these because Everett Fire is also an organization that meets you where you are, no matter where that is, and no matter the time of day. And by the time an opioid user encounters the fire department, in most cases, they have overdosed. And in most cases, when they've overdosed, they stop breathing. And then the question just becomes, can Narcan be administered soon enough to counteract the drug and let them start breathing again on their own? And if not, then a full medical resuscitation has to occur. And so the first impact is to the people, but measuring that impact is difficult, and certainly quantifying it in terms of dollars is extremely difficult. And so the next thing that we looked at is what is the impact to the fund in terms of wear and tear on equipment and vehicles. And so part of what the ask to the community development department as they're managing their spending plans for this is, would you consider reimbursing the fund for the expense of a new ambulance and the equipment that it takes to equip the ambulance? An ambulance today is about $350,000. They are currently 2 years out if you ordered one tomorrow, so it's not going to happen anytime soon. In the bigger picture, we anticipate asking the community for a levy lid lift on the EMS fund sometime in 2026. And so assuming the community supports all of these things and knowing that as the community grows, the demand for EMS services is going to grow also, we anticipate the need for a fleet expansion in the late 2020s. And so if we order one sometime later this year and it arrives in a couple of years, the timing on that is just right. And the dollars that we're talking about won't be spent until the thing is delivered. So it's not going to be a drain on the fund immediately, but we would like to ask you to consider earmarking those funds so that we can begin the process of ordering a new ambulance and getting in the lineup to get one delivered in a couple of years. And so that is the nuts and bolts of what we're asking here. In terms of response, you can see the response times here. We are a part of the citywide strategy to manage the epidemic. I didn't include anything on the buprenorphine project, but I did run the numbers just before I came over, and we've currently encountered 34 people that have agreed to a buprenorphine dose, and we've administered 44 doses. And the criteria for the delivery of that, and there's only 5 places, I believe, still in the state that have a test protocol with the Washington State Department of Health to allow the delivery of buprenorphine in the field. But the criteria around that is they need to be conscious enough to understand what has happened, and that they need to be conscious enough to consent to receive the medication and also agree. And granted, some of them change their mind after they get the medication, but they need to agree to meet with the social worker and have a conversation about recovery programs available to them. And the partnership that we've created with the care team and the paramedics and the delivery of this medication has been a model for the rest of the state to look at. And I think that Washington State is contemplating creating this protocol for the entire state. So that is just a little bit about how we're involved and why this fund should consider reimbursing EMS for this expense. So thank you.
So any questions? We obviously don't have a resolution or anything that we're bringing forward because this is all kind of new for us, right? So you can maybe chat about what kind of process, or Jennifer obviously could give feedback on what might be a process for this. When we had COVID recovery funds, we obviously came to you with resolution if you are going to choose to allocate a certain amount of money. I don't know if that's because if it's going to be a couple years, I would understand why we would want to be able to ensure that we know that it's an expenditure that we're going to be taking out of these funds.
Do you have other expenditures that you're thinking about that, would come at the same time, or? Because this
I
is a
have a-
lot of money.
yeah,
that
it is
we're
a lot of
sitting
money.
on, and so
Yeah.
I just want to make sure that we're,
Well, I have a meeting with Chief DeRoos in the next week, and I have another idea that I'd like to bring forward to him. And so after that, I'd be happy to come back and bring more. Obviously, we want the ongoing expense of the coordinator, but we also have opportunities if we wanted to do some kind of granting out to the community the county's already doing that. They'd be willing to kind of manage that for us. So we have a lot of conversations that we're having. We also obviously have a uncertain federal government grants that we are paying close attention to. And our CARES team right now is 100% funded by something that we do not know will be here after October. And so with that, we also that might be another opportunity, because certainly, again, not only are CARES crisis responders working with people that are unsheltered, but they're also obviously working with our fire department. They're working in people's homes that are seniors. They're working with families that are youth, and many of them are affected by the fentanyl and opioid crisis. So it's very, very relatable to use opioid funds to support the community response teams.
yeah, I think it'd be really important for us to kind of wait and see what happens at the federal level. I know a lot of organizations, we're all feeling that.
Yeah.
It's, a little scary with some of our programming, so. Okay, what, do you guys have any? Oh, yes, go ahead, Councilmember Bader.
I apologize if you covered this in the previous meeting, but are there any legal restrictions on what they can be used for, or whether it's legal from governments that are sending the money or from the settlement itself? And then any or beyond that, best practices that are developing on how to spend them?
Yeah, interestingly, we are lucky in the sense that Snohomish County has been doing this opioid work for many years, and they have been being on beta testing and being at the top level, having conversations around these funds. And the advisement that we have from them essentially is, we've all signed the contracts. The contracts are the same for every settlement, and the healthcare authority, BHASO. The BHASO is managing the fund, sorry. And their requirement is to hold a opioid abatement council. And the abatement council doesn't have true responsibilities, except if a jurisdiction is reported to not utilizing the funds in a way that benefits or, sets forth in the settlement, which is that prevention, treatment, and then the other strategies. And so it's a very broad definition of how these funds can be used. So we can't fix our sidewalks. We can't, plant trees. We, need to.
And I can see the connection now with what are we calling it, a vehicle or, but when I first saw it, I was like, well, what does that have to do with it? I see the obvious connection now, but that got me wondering what the scope or the
Sure,
guidelines were
absolutely.
for
Yeah,
use.
I appreciate that.
Bossy?
Thank you. So with this is Everett's numbers, correct? On the data that you provided?
Yes, those are for the Everett Fire Department, yes.
Okay, I'm aware that obviously Everett was disproportionately impacted by this epidemic. It'd be nice just to have a little bit of that data, a little bit looking at statewide or comparative or something that you think relevant, just to kind of understand a little bit more of the scope of the problem. If you're able to email something along those lines, I'm sure we probably have data somewhere that you guys have.
Yep, I can package up, and we can spend a little bit more time diving into the Department of Health data on the second one.
Very briefly, yeah.
Okay.
Thank you.
Okay, any other questions? All right, well, thank you. Thank you all for the update. Lots of good stuff. So thank you. And now we're on to the fire. Is that what no, that was it. Do we have anything else, Jennifer?
We don't.
Okay.
For tonight. We do have a few things for. Currently, I think these things are all set for next month. I
Okay.
might revisit them with staff and make sure it makes sense to do all of them next month, but if you want me to go
Yeah,
through those.
let's hear.
The soda ordinance is up for a renewal, and so we want to get that a briefing probably to your committee, I would think. And I have talked with the team about the direction that council gave when we did the last renewal, which at the time added Jackson and Wiggins Hollow Park, I think. And council had asked about, does this tool make sense for any or all parks in the city? So they are doing that analysis, and they've said they'll be
good.
ready for that June discussion.
Great.
I haven't 100% committed them, but that is the plan. You've asked a few times, and I think we will be ready in June for an automated traffic safety camera update on that
Okay.
program. And then we'll have, I think I'm having our Trevor, Justin, our lobbyist, come to your full council meeting on the June 4th meeting
Uh-huh.
to do kind of a legislative wrap up. It felt like a long time after session, but then I've looked at like AWC and others, they take a while to assess. So I don't feel so bad about taking a few weeks to trot him out to do that. I'm still gonna see if there's maybe something specific that makes sense for Health and Safety Community or Healthy and Safe Community Committee. The legal folks do some analysis for the police department. So maybe there's some like specific things that would be good to kind of dig into a little bit more at this committee level versus a broader briefing at the full council. So maybe that one is a little in flux, but that's what I have for next month's committee meeting. And, you know, the chief's here if you want to ask him about emphasis patrols. I'm not going to stop you.
All right, a little add-on to our agenda.
But also if there are like related questions too, I
Yeah.
think Councilmember Fossey might have some.
Oh, yes.
I just wanted to see if when you brought forward the conversation on soda, if you could vaguely bring forward also some kind of how they measure their success like that. Yeah, that would be helpful.
Yeah, definitely. That makes sense. Yeah.
My turn?
Your turn.
Yeah, and you just wanted me to talk briefly about our emphasis patrols related to loud mufflers?
And in fact, if you want to make them more broadly, any other emphasis patrols, how those are going, future plans, that kind of thing was kind of my curiosity.
Yeah, we get quite a few complaints regarding loud mufflers, or I shouldn't call them loud mufflers, that'd be a conflict of terms, but loud exhausts. Some people it seems like you hear them more during the summer. So as time warms up, we see and hear them quite a bit more around town. We did do one recently. I sent council an email about it, but I'll just read some of the data that was collected over the 3 days. So we had 6 Everett police officers work 4-hour shifts over 3 days, total of 24 patrol hours looking for altered exhausts or enhanced mufflers. We made 35 stops and we issued 23 infractions. Of the 23 infractions, we issued 19 were related to altered or enhanced exhausts. So I know that's just one operation, but we've got another one that's planned. I'm not sure what the exact date is. But I think, well, I want people to know that we're out looking for this. It's really interesting because on social media, we saw a lot of people that were complaining about us spending our time doing that. But I know when it comes to quality of life, these things can be quite annoying. We have at least 1 or 2 North End community members that it affects their sleep, it impacts their day-to-day life, and they've let us know that many times. And we understand. We just have to set aside time to go out there and look for it. Sometimes it's a little more difficult for our average patrol officer that's trying to handle 911 calls to also spend time looking for altered exhaust systems.
Great. Any other questions for the chief?
Just want to say thanks very much for doing that. I think it's important quality of life. I mean, and I get the social media thing, but if we let that drive us, I don't think we'd ever do anything at all. Because there's always going to be, I think, some negative response on social media. So appreciate you doing that very much.
Yeah, it's important for the community to know we spend a lot of time on all things related to quality of life and criminal activity. A portion of that time just needs to be dedicated to some of this lower level activity that affects this community overall.
Great. Thank you so much.
Yeah.
All right. without any other questions, I think we're,
Actually, maybe have
Oh,
one
yeah,
more.
go ahead.
And I know we had some information shared, I think by Chief DeMarco about the lift ordinance coming our way. And what is that going to be something that happens after our next committee meeting? That should come to us, or?
Yeah, we could bring it back. I think we just scheduled it for, yeah, June 25th. So we could talk about it at
Okay.
the beginning. Yeah. Yeah, I think it's certainly ready. So.
okay. All right. Anything else? Great. Well, thank you all for coming and we'll see you next month.